If you are struggling to find the uterus in your bitch space, do not stress. This is normal for everyone at first. The more space you do, the quicker you will get. The biggest problem with bitch space is the variety of sizes of the uterus. From a few millimeters in a large dog to over a centimeter in a small dog. As a mentor, it's difficult to explain how to easily find a uterus. This is something that develops with time. The more you feel different uteruses, the easier it will be to find them. Remember, it's like being in a dark room, trying to find something you have never felt before, so do not despair. Unfortunately, COVID has resulted in a lot of changes. For veterinary students on extramural studies, I have noticed a massive difference in new graduates. Regards surgical ability, pre and post-COVID. After COVID, vets seem to have stopped letting students get involved in surgery. Pre-COVID, they were allowed to close and feel uteruses and perform other bits of the surgery. So sadly, new graduates now have had the least exposure to surgery, and only the veterinary profession hand out a degree in surgery to someone who has never done surgery, and then you are thrown in the deep end on your own. So, I made this video to help with advice on how to find a uterus in a dog. This is to try and make you understand certain approaches to help you find the uterus. The drawing is basic, but should be helpful. First of all, there is a large difference in size and bifurcation point between post-first season and pre-first season. Pre-first season, the uterus can be millimeters and the bifurcation is very caudal. This is why we make our incision point more caudal to the umbilicus. Post-first season, the uterus is larger and the bifurcation more cranial. Hence, the incision is closer to the umbilicus. We do this to make exposure of the ovaries better. Now, the biggest problem we have in finding the uterus is the intestines, which occupy all of the abdomen. The area you want to be looking is cranial to the bladder, where there is really only colon and uterus. Before you start, while the patient is in lateral recumbency, if the dog is thin, you can feel the flick of the colon and sometimes the uterus in this area. The other variation is how deep is the uterus. With younger dogs, the uterus is deeper down, where older are often higher up. The key is to keep all the intestines behind your index finger, sliding down the body wall until you touch the vertebrae, and then slide your finger off the vertebrae into the well and start sliding up the body wall, keeping your finger hooked, and hopefully you should feel the tautish band of the uterus. The best way is to imagine the uterus running parallel to the vertebrae. With older dogs and uterus being higher, quite often new graduates pull out the uterus, but think it's intestine and put it back. Always check for an ovary or bifurcation if you think you have the uterus, and then you can be sure. Watching the series of bitch spays, focus on different uterus sizes and looks. Don't rush through them. It's the little things and the little knacks that make spaying a bitch easy. I will also give you advice on changing the approach when the spay is more difficult.